Right. So you've watched the video, those who are here, and that's a woman in China who performed who performed first aid for someone who's choking in a restaurant. And it's actually very common for people to choke when eating, and food is one of the most common obstruction or object that gets stuck in the airway. And whenever something like that happens, whenever you have anything in the airway that's not supposed to be there, that's what we call choking. Okay, and the video you watched, the woman did this thing called the Heimlich maneuver, and it was spelled out in the video, right? Heimlich. Heimlich. It's a surgeon's name, an American surgeon's name who invented the method. That method is used to help someone who is choking. It's also known as the abdominal thrust. Okay, and you can also see, if you remember, she slapped the person's back like that. That's called a back blow. And all these things you will learn in a while in this topic. So let me just introduce you to what choking is. All right, so choking is also known as foreign body in airway. Okay, foreign body airway obstruction. It's when there are things in the airway when things are not supposed to be there. So you know from your science and biology the anatomy of the airway, right? So you have the anatomy of the airway. You have the nose over here, the nasal cavity, and the oral cavity over here, as well as and this is your tongue in the oral cavity. And whenever you breathe in, okay, air enters the airway, okay, and it will enter the airway whenever you breathe in, because this thing, also known as the epiglottis, I'm not sure if you guys are familiar with this, but the epiglottis is always open to introduce air into the airway, okay? And at the neck area, your pharynx, your throat, you have two pipes, okay? You have two pipes. The first pipe in front is your trachea or your airway, and the pipe behind here is your food pipe, which is the esophagus. So whenever you are breathing, talking, or at normal, when you're not swallowing, the epiglottis is always open for air to enter and air to come out. But whenever you swallow, the epiglottis will flop down, will cover the airway, so that it will lead the food to the back pipe, which is the food pipe. That's during swallowing. So whenever you are choking, this is what happens. Probably you're eating and someone tells you a very good joke, so you start laughing. So when you're laughing, what happens? Your air has to come out, so the epiglottis will open. And the food that you're currently chewing or swallowing will enter the wrong pipe. And this is what happens in choking. Okay? It's when food or any foreign objects accidentally enter the wrong pipe, which is the airway. Because the only things that's supposed to be in the airway is air and maybe some mucus, because the lining of your airway is supposed to be moist with mucus. Okay? So whenever you have any foreign objects in the airway, that's choking. Okay? And it is a life-threatening emergency. Because if you recall from our past lessons, we have this thing, the causes for unconsciousness. One of the causes is asphyxiation, right? When you can't breathe. And choking is an example of asphyxiation, right? Because you have something in the airway, hence you cannot breathe. And once you can't breathe, you can't take in oxygen. What happens is that you're starving your cells in your body, especially the brain cells, of oxygen. And when that happens, you can fall unconscious and you can die. And we've covered the importance of oxygen and how the brain is very sensitive to the lack of oxygen in the past. So choking can lead to death. Okay, it's a life-threatening emergency. So that's why fast response is very important. If you know how to recognize choking, you know how to give immediate treatment, you can save a life. Okay, and there are many videos online showing you instances where people are choking, and then some educated Samaritans come to rescue, and it is very good because you're saving a life. And hopefully after this lesson, you guys have an idea on how to perform the Heimlich maneuver, how to react in a case of choking. Okay, all right. So what can someone choke on? Right, they can choke on food, and this happens when they are eating or drinking. Okay, when someone is eating or drinking and someone tells a good joke, or you're trying to laugh, talk at the same time, you can potentially choke. And it is also associated with certain problems with the muscle, as well as the nervous system, the brain stem, the brain, the spine, the spinal nerves. Okay, because especially in the hospital, when people are ill, old people, for example, or ill people who are sick, they have problems with chewing, swallowing, and this can lead to choking or aspiration, as you might hear sometimes. Okay, so choking occurs during some of the examples of when choking can occur is during these times. And people can choke on food, which is the most common obstruction. Okay, as you can see here, this food bolus is entering the airway instead of the esophagus behind that. It's supposed to be to the esophagus, but because the epiglottis isn't closing the airway, it enters the airway instead. And yeah, this person's probably, you know, trying to like laugh at the same time while swallowing, right? And in children, if you have younger siblings or younger cousins or niece and nephews, you want to look out for them, because younger children, especially children under the age of like 5 years old mostly, they like to put everything in their mouths, right? Because they're kids. So everything that they touch goes in their mouths, and there's a choking hazard over there. And many toys which are like tiny or detachable, like Legos, they often come with choking hazards, warning, right? So they will say choking hazard, please, or they have a label. These toys are meant for children above the age of 6, above the age of 8, because they're small and they are choking hazards. So if you have younger siblings or younger people around you, you want to look out for them. Make sure they don't put everything in their mouth, and if they do, make sure they don't swallow it, okay? Because they can choke on it and then die, and might die. I'm sorry. Okay, right. So this is a classic picture of someone who's choking. They probably will be like slapping their chest real hard and then coughing. Okay, he probably choked on his burger. Okay, so this is a classic picture. Right. And choking is divided into, or is classified into different severities. So you have severe obstruction, which is severe choking, and mild obstruction, mild airway obstruction. And the difference between these two is essentially the ability for them to cough. So in severe choking, they can't cough, right? Because if you notice, when you cough and you put your hand in front of your mouth like that, and you cough, there's air coming out. In fact, the air that comes out is actually quite forceful because of the built-up pressure within your airway, and then you cough it out. So in severe choking, think of it as the obstruction has completely occluded the airway, completely blocked the airway. Okay, so when it completely blocks the airway, can air come out? No. And when air can't come out, you can't effectively cough, because coughing essentially is pushing air out of the airway and out of your mouth. Okay, so in severe choking, think of it as like a complete obstruction sort of thing. So you can't breathe, you can't talk, you can't cough. And in talking also, you can't talk as well, because talking is essentially air moving out of your throat, out of your airway, through your vocal cords, and that's how you talk. That's how sound's produced, right? If you put your hand in front of your mouth and talk out, you can actually feel air. So when you have severe obstruction, complete obstruction, or almost complete obstruction, is very, very it is difficult to speak. In fact, you're unable to talk. Okay, unable to talk, unable to breathe, and unable to cough. Breathing, in a sense, because the nasal cavity is connected to the back of the throat as well. Yeah, you breathe here, and you can also breathe through your mouth. So just remember, breathing and the airway and the mouth is like the nose, the mouth, and the airway sort of like connected in a sense. Okay, which is also why sometimes when you cough too hard, things can come out through your nose as well. If you notice, like, I'm not sure if you guys have ever choked before on like food or whatever, or water. It's like coughing really loudly or very hard, or very forcefully, and then the water or whatever also spills out through your nose, because it's connected, and the cavity is continuous in that sense. Okay, and the other classification, the other severity is mild obstruction. And in mild obstruction, it's not as bad, it's not as severe as severe obstruction. So you can still have effective cough, you can still cough, and you can still talk, and you can still breathe. Okay, so between the two of these, how do you know if it's mild or severe? Because as you can see in this graph, the treatment is very different. Okay, one of it can lead to unconsciousness, and you have to do CPR and all that, difficult stuff. And the other one is you just have to encourage them to cough. So it's very different. But how do you know when to give which, right? So if someone is just choking, it has mild choking, can cough, okay, they will be able to show you these things. They can talk, they can take a breath before they cough, and their cough is very loud because air can effectively move past their airway, and their face can turn red, right? And they are responsive because they're not exactly fully deprived of oxygen just yet. because it's just mild. They can still breathe, albeit difficult, but they can still breathe. They can still talk, albeit difficult, but they can. So they are fully responsive. Okay. And when someone is choking, mild choking, what you do for them is really just you encourage them to cough. Okay, you can encourage to cough, because like I said just now, coughing sort of like it produces this high pressure force of air that can help to expel the obstruction that's stuck in the airway. All right. And we don't encourage you to do the other thing, which is the back blows and the abdominal thrust where you press on their abdomen, because those things can be quite harmful and it's unnecessary. Okay, it's unnecessary yet. It's not necessary yet, so you don't have to do it. And bear in mind, whenever you do things like CPR, chest compressions, abdominal thrust, there's a potential for internal injuries, and you have to send them to the hospital or the clinic to get it checked out in case you broke a rib, in case you damaged some internal organs. It is dangerous, but it saves lives, so you do it anyway. But if you can avoid it, if it's not indicated, as in mild choking not indicated, then you don't do it. All right, you just encourage them to cough. Now after the object is expelled, so they cough and it comes out, what you do is you continue to observe the casualty, make sure they are fine, as in they are okay, and get them checked out at the hospital. If not the clinic, at least the clinic, because there can be remnants of the obstruction stuck in the airway, and this can lead to severe airway obstruction in the future, like subsequently. And infection also can lead to infection if it's stuck in there and then it rots and whatever. So you want to get them sent to the hospital or to a clinic at least to get it checked out. The doctors will then auscultate using a stethoscope, the lungs, for breath sounds, and maybe do some scope or X-ray to see if there's anything stuck in there, left in there. Okay. So remember, observe and send them to the hospital after the object is expelled. Okay. And this is, of course, we're talking about like obstruction. Sometimes when you eat and then you start to like feel choking, maybe like when you're swallowing water, just a little bit, you might think, oh, that's so dramatic, like just a bit, and you want to go to the hospital. So you can depend on the severity as well. If it's just a bit of water, it's okay. But if you're choking on food or like particles that's bigger, more solid, you might want to get it checked out. Okay. Now, what about severe choking? So in severe choking, they are unable to cough, unable to talk, unable to breathe because their airway is completely obstructed by the food or whatever foreign objects. And you can see that their face is turning purplish or blue because of the lack of oxygen. So this is what we call cyanosis. Cyan as in the color, bluish, right? So when you have cyanosis, your lips, your skin, your mucous membrane turns bluish or grayish blue, okay? And they can be losing consciousness because they're not taking enough oxygen. And what you do for them, if they're still conscious, say the beginning stage of the severe choking, can't talk, can't breathe, can't cough, but they're still conscious, you give them 5 back blows and 5 abdominal thrusts, and you repeat this until the object is expelled. And that's what you saw in the video in the beginning when I showed you while waiting for other friends. But we'll go through it again to see how it's done. Okay, so the back blows, give 5 of it. Abdominal thrust, give 5 of it. Just repeat this until the thing is out or until the person falls unconscious. And this is how you do a back blow. You lean the person forward and you slap the back between the shoulder blades. You know you have your shoulder blades, the scapula, the bones, like the wing bones as you call it. Slap between it. Okay, don't slap on it, you might break it or dislocate your shoulder. But you slap between it and you give 5 firm back blows with the heel of your hands. Okay, the hard part over here. All right, now we're gonna see how it's done.
This is the primary response to a conscious person choking. So in this one, what I'm going to do, it's a blow with my heel. I'm going to move you here. Right here between our shoulder blades. It's up high. The object is right on the other side of my hand. So I'm going to do a hard focused blow to get it out. It's basically, if this was Gulia's back, right here. Now, an important safety thing, I've got to have control of her, because if I come in here and really hit hard, she could fall down. So what I'm going to do is get right here and I'm going to get control of her. I'm going under her arm, grabbing her shoulder, and I'm going to lean her over to use a little bit of gravity to help get the object out and hit right here, hard. And it can jar it loose, and often they'll just spit it off or cough it out. Occasionally even comes flying out, but it's very effective. This is
So that is for back blows, and you do that when someone is still conscious and they're choking severely, as in they can't talk, can't breathe, can't cough. You do the back blows 5 times, followed by an abdominal thrust, or the Heimlich maneuver, as we've mentioned in the beginning of the video. Okay, in this video, in the beginning of the lesson, in this video, they're going to show you how to perform the Heimlich maneuver. Okay, and she's going to mention in the beginning that you only do this if they can't breathe, can't speak, or can't talk, can't cough, indicating it's a severe choking. All right, and yeah, and she also mentioned if someone can talk or can cough and can breathe, you do not do this. Instead, you just encourage them to cough because it's mild choking. Okay, so watch this.
If they are coughing, then they are able to breathe, and you would not perform the Heimlich maneuver on them. In order to do this, you stand behind the person and make a fist with your thumb pointing back against you, midline between the belly button and the rib cage. Grasp that fist with your other hand and pull back and up quickly until the object is expelled or the person loses consciousness and needs to be lowered to the ground to begin CPR.
All right, so that is how you do the Heimlich maneuver, and she has demonstrated to you where to put your hands and how to position your fist. Okay, so when you do that, you're forcing air up the airway and you can expel the object. Okay, that's the abdominal thrust, also known as the Heimlich maneuver.
If they are
Next video also shows you how to do it, but in more detail on how to push. Okay, and you'll see that he's gonna mention is a scooping motion, in and up, scoop. All right, and we'll watch it.
The technique I'm going to show you here is called abdominal thrust. You probably know it as the Heimlich maneuver. So what I'm doing is I'm getting behind her, I'm finding her hips, and I'm coming, that's my marker where my hands are going to go, and I come right across from her hips to right here with a fist. I'm around her belly button, maybe a little bit above it. Other hand is on top of this fist, and now I'm ready to pull in and up, which we'll show you. I'm going to move you this way. Once I'm here, this is the part we can't practice, I'd start going in and up. It's kind of a scoop motion. What I'm trying to do is get into her belly and then take all the air that's in here and bring it up, right up through the trachea to dislodge the object. This is very effective. It's really common within just 1 or 2 or 3 of these thrusts, the object will come flying right out.
All right. So that is the Heimlich maneuver. Just remember, you do it midline of the casualty's belly button and the ribs. So don't press too high because that's where the ribs are. You're going to break it. And don't press too low because that will be ineffective. So between the belly button and the rib cage, midline of the abdominal cavity, the abdomen. So here, this is the ribs. This is the belly button down here. You do it in the middle. Okay? Put a face like that and push and in a scoop-like motion.
The technique.
All right. So after you've done that, the object should be expelled. But if it's not expelled, logically speaking, when you're deprived of oxygen for so long, say a minute or 2, you will fall unconscious. And if you fall unconscious, what you do is you want to lower the person down and you want to start CPR. And we've learned CPR last week, but we're going to just do a quick revision in the next video. But I want to highlight to you that it's the 30 compressions that you must do. Because the 30 compressions, not only does it help you to dislodge the object, it also helps to promote circulation. Okay, so do 30 compressions. Check the airway, as you would before you give the rescue blows. Check the airway to see if there's any object inside the airway. Because as you do compressions, you are essentially pushing the object up, right? Dislodging the object. And when you do that, there's a chance that the object, which is not visible at first, can be pushed out and you can see it in the mouth. And when you can see it in the mouth, if it's visible, you can do a finger sweep. You can put your finger inside the mouth and lift it out, take it out, okay? And as for rescue breaths, there are many questions about, must I do rescue breaths? It's a bit unsafe, I'm concerned. That's okay. If you are uncomfortable with it, or if you're not sure you can do it, as in you're not confident with it, you can opt to skip rescue breaths, but you should not skip compressions because chest compression is essential. It's very vital. It can save lives. Okay, so if you're not doing rescue breaths, after 30 compressions, check the airway, look for the object and see if it's visible. If it is visible, take it out and then continue compressions until the person is conscious again. Okay, and this quick video, we're just gonna like revise a little bit on what and how to do CPR.
Hello. In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC. And if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've...
Alright, so that is the revision for your CPR. I hope you guys still remember it from the last week's lesson. So knowing CPR is important, and in a case of choking, if they are unconscious, you want to shout for help, you want to do compressions, check their mouth for obstruction, take it out if possible. So you can apply CPR over here. Okay, and after, let's say you have removed the obstruction from the mouth and they're still unconscious, and that's when you continue CPR, 30 compressions, 2 blows if you're comfortable with it. If not, then just continue with circulation, as in compression. And you want to get an AED if they're still unconscious with no breathing. So just do as you would in CPR. Okay? Now, when you're doing rescue breaths, you should not try more than 2 ventilations per cycle, because it's 30 compressions and 2 rescue blows, right? And that's if you're doing rescue blows. So let's say when someone is choking, there's a chance that when you give them rescue breaths, their chest won't rise. But if that's the case, that's okay. Don't just keep doing it. Do 2 rescue blows. If the chest doesn't rise on both occasions, don't attempt to give the 3rd or the 4th rescue blows because you're wasting time. Instead, you should just continue with chest compressions. Okay? Because compressions can help to clear the airway. So this is the airway as you look into it. This is the uvula, these are the tonsils, there's the tongue, there's the palates. So when you do compressions, you're pushing the object out, right? And after say 30 compressions or 2 rounds of 60 compressions, the object can be dislodged, can be moved into the upper airway, and you can see it. And once you see it, you can remove it. And the maneuver we use to remove an obstruction in the airway, in the mouth, is called the finger sweep method. And how you do it is you open the airway, okay, open the mouth, open the airway using this method called tongue jaw lift, which is how we'll see in the next slide how to do tongue jaw lift. But you do tongue jaw lift, then lift the jaw up, open the mouth, and look into the mouth. Can you see the obstruction? And if you can't see the obstruction, put your finger in it and take it out, sweep it out. But if you can't see the obstruction, do not attempt blind finger sweep. Means you don't go in there and go like, oh, I'm fishing for the object, let's see left and right. No, don't fish for the object. Don't do a blind finger sweep because you might dislodge it even further in, or you can injure the person. Okay, so instead of doing that, don't do blind finger sweep. Instead, you should do CPR. Continue with chest compressions. Okay. Now, tongue jaw lift is done. So you like that. So if possible, wear gloves because it's part of D for danger, right? Hazards. So if you have gloves, wear gloves. Put your finger, your thumb into the person's mouth and press down on the tongue. Okay. Press down on the tongue to lift it out from falling behind. So press on the tongue, hold the jaw and hold the neck. Okay, so hold the jaw and hold the neck and lift it. Okay, lift the mandible as in the jaw, lift it up and out. Lift it and use the other hand to stabilize the head on the forehead like that, and do not hyperextend the neck. So don't overdo it. Okay, just lift the jaw like that, look into the mouth. And if you can see it, you can put your finger into the mouth and sweep the object out. Okay, and this is how you can do it. Right? So in this scenario, like he demonstrated that he can fish the object out and the object happens to be a cotton ball. But in real life, it could be lots of things, food and everything. Sometimes you might need more than just one sweep, okay? Because food is like, it breaks apart. So if you can see it, as long as you can see the object is visible and you're confident you can take it out, take it out. Okay, and then continue CPR if the person is still not breathing. Right. And after you have cleared the object and the person is like conscious again, whatever, responding to you, you want to send them to the hospital because, like I said before, abdominal thrust, chest compressions, these maneuvers are very aggressive because it involves pressing on structures of your body and you can cause internal injuries. So they have to be examined in the hospital. Okay? And you should be sending them to the hospital anyway because remember, before you start CPR, you're supposed to call for 999. So they're supposed to be on the way. Right? So just remember this, send them to the hospital. Okay, so this is a quick recap on what we've learned today. So in this video that I'm going to show you now, they have 3 scenarios. The first scenario is when the person can cough. The second scenario is that they can't cough it out, but they're still conscious. And the third scenario is when they can't cough it out and they have fallen unconscious. Okay, so please try to recap what we've learned today. It's a summary.
In this video, you'll learn to administer first aid to a person over the age of 1 who is choking. There are 3 possible scenarios. Scenario 1. The casualty is breathing, but with difficulty. Encourage the person to cough and don't do anything else. Coughing is the most effective way of dislodging an object. Doing anything else could worsen the situation. Scenario 2. The casualty is not breathing but is still conscious. Support their upper body with one hand and lean them forward. Give them up to 5 sharp back blows between their shoulder blades with the heel of your hand. If the back blows don't work, alternate with a series of 5 abdominal thrusts. Place your hand clenched in a fist in the middle of the abdomen just below the sternum in the hollow of their stomach. Place your other hand over it. Bend the casualty forward. Pull sharply inwards and upwards. Alternate 5 back blows with 5 abdominal thrusts until the casualty is breathing normally. Scenario 3. None of these procedures has worked and the casualty loses consciousness. Call or get someone to call the emergency services and start cardiopulmonary resuscitation. Alternating 30 chest compressions with 2 rescue breaths. If you don't know how to give mouth-to-mouth breathing, do chest compressions only, at a rate of 2 per second. Continue CPR until medical help arrives or the casualty starts breathing normally.
Right, so remember these 3 scenarios and what you can do as first aid. Okay, now the next slide, which is the last slide, is just a table of summary comparing between mild and severe choking because they require different treatment. For mild choking, they can talk, they can breathe, they can cough, right? They're fully responsive. So all you do is to encourage them to cough. Okay, and if they fall unconscious at any point of time, which they wouldn't unless they go into severe choking first and then they slowly lose consciousness. Okay, you need to do the method for severe choking, which is back blows and abdominal thrusts. Okay, and if they fall unconscious, do CPR, finger sweep. Okay, take the object out and send them to the hospital. All right, and in severe choking, you know it's severe when they can't talk, they can't breathe, and they can't cough. Or if you try to cough, it's silent. So it's like, okay, no sounds come out, but they're trying to cough. Again, their face, the skin can turn purplish or bluish. Okay, and then they are losing consciousness. And when they lose consciousness, like I said, you do CPR, take the object out if you can using finger sweep, and make sure you send them to the hospital. Okay, so that is all. That concludes my lesson for today on choking. Do you guys have any questions about this topic? Right. So for those who missed it, I'm just gonna play this out for the next 1 minute before we end the class. So just. All for today. So I hope you guys can see how it's done, like in real life. You can actually really practice it and it can really save a life. And yes, the video, you might think, hey, she didn't do 5 and 5, she just kept doing abdominal thrust and she's, but it's okay, sometimes in the heat of the moment, and it's how it looks like. It's exactly like that. It will be rushed, people will be like crowding, there'll be noise. It's not as calm as in the videos, the tutorial videos that I showed you just now, but hey, you have to start from somewhere, right? You learn, and then you can apply them in real life. All right, so it will be messy. You might freak out a little bit, but as long as you know what to do, keep calm. Okay, remember these 5 back blows, 5 femoral thrusts, and remember your CPR. And I think you're good to go. Okay, go out there, save lives. All right. So thank you very much for your attention. Take care. Stay safe. Goodbye.